magandang umaga.
Magandang araw din.
So first baby niyo po?
Hindi.
So pangilan niyo na po yung baby?
Mga pang-sampu na.
Ganun po ba? Wala po ba kayong family planning master or contraceptive na ginagamit?
Wala eh. Wala naman kasi kaming alam sa tungkol dyan eh.
So ganun. Maaari ko po ba kayong hingin ang inyong konting oras para panoorin o talakayin ang patungkol sa family planning?
Sige.
Sige, dito po tayo.
Family planning allows people to have children when they are ready to start a family. Family planning services usually include general health information, health history, and physical health exam, as well as birth control methods or contraception. This healthcare enhances individuals' general health and contributes to good pregnancy. Family planning services assist people in making decisions about when and if they want to have children by providing information, counseling, and birth control techniques. Planning for a child will help you avoid the social, health, and financial issues that might arise from an unforeseen pregnancy. Today, there are several birth control methods and procedures accessible, but now we will learn and focus about contraceptive pill. Here are some questions you may want to consider. What is birth control or contraceptive pill? What does contraceptive pill for? How to use it and how long must it take? What are the pros and cons of using contraceptive pill? What are the benefits and advantages of this? What are the studies regarding on how effective this pill? What is the percentage of people who are using this pill? Who are those people who can use and who are those people who must not use this pill? Okay, so what is birth control or contraceptive pill? Birth control pills are kind of medicine with hormones. Birth control pills come in a pack and you take one pill every day. The pill is safe, affordable, and effective if you always take your pill on time. Besides preventing pregnancy, the pill has lots of other health benefits too. So there are two kinds of birth control pills. The combination pills or what we call combined oral contraceptives or COCs. These pills have both estrogen and progestin. These are the most common type of birth control pill. Another kind of birth control is progestin only pills, POPs or mini pills. These pills only have progestin. So what are these pills for?
What contraceptives do? It is a daily pill that contains hormones to change the way the body works and prevent pregnancy. Also, it prevents pregnancy by avoiding unprotected vaginal sex during most fertile days. Hormones are chemical substances that control the functioning of the body's organs. In this case, the hormones in the pill control ovaries in the uterus. Most birth control are combination pills containing a mix of the hormones estrogen and progesterone to prevent ovulation.
So how to use birth control and how long must it take? According to WebMD, in taking a pill, you may take your pill every day at the same time. This is especially important if you are on a progestin-only mini pill, which has a smaller margin for errors than a regular pill with both estrogen and progestin. It may help to set an alarm on your phone or post a calendar on your fridge as a reminder. So, when you finish a packet, you may now take a first pill from the first packet the next day. So there are 4 types of pill, and with those type of pill, your periods may get more infrequent or bleed much less.
Okay, so let's now talk
about the pros and cons of contraceptive pills or birth control. Let's go first to pros. Here are some of the benefits of birth control. First, it reduces the risk of ovarian, endometrial, and colorectal cancers. Second, it reduces acne and hair growth or hirsutism, and it can make our periods better, fewer and less hypobleeding or menorrhagia. And one of the great things about contraceptive pill is you can get pregnant right after when you stop taking it. So the contraceptive pill is safe, easy, and a practical method of preventing pregnancies, most especially for teenagers. So now let's proceed on cons. These are the unhelpful benefits of taking contraceptive pills. First, when pills are skipped or taking it late, it reduces the effectiveness. Second, there is no protection from sexually transmitted disease, also called as STD, and here are some of the temporary side effects such as headaches, mood swings, temporary bleeding, bloating, nausea, and depression.
You know, birth control pills can help you avoid getting pregnant, but the pill can have other benefits too, including making your period less painful and more regular, clearing up your skin and lowering your risk of cancer. Beyond preventing pregnancy, there are several advantages using birth control.
Unfortunately, all forms of birth control have side effects, and most of the side effects will improve if you continue to take the pill over the period of time. You may experience some common side effects include spotting, nausea, breast tenderness, and headache. So now, I will discuss to you what will be the definitions of these common side effects. So first, the spotting between periods. Breakthrough bleeding or spotting refers to when vaginal bleeding occurs between menstrual cycles. It may look like light bleeding or brown discharge. Spotting is the most common side effects of birth control pills. It happens because the body is adjusting to changing levels of hormones, and the uterus is adjusting to having a thinner lining. Ang pagkakaroon ng paminsan-minsan o pagpatak ng dugo maliban sa regla ay karaniwang side effects ng birth control pills. Ito din ay pinapaiksi at pinapaunti ang regla at normal din ang hindi pagkaroon ng dalaw. So, second is the nausea. Some people experience mild nausea when first taking the pill, but this usually subsides. Taking the pill with foods or at bedtime may help. Birth control should not make people feel sick all the time. If the nausea is severe or lasts for a few months, it is best to talk to the healthcare provider. Ang pagsusuka o nausea o pakiramdam na nasusuka ay karaniwang nawawala pagkatapos ng 1 o 2 buwan. Kung ikaw ay nahihirapan, subukang inumin ang pills kasabay ng pagkain o sa ibang oras. Okay, so for the third one, we have the breast tenderness. Taking birth control pills often causes the breast to feel tender, especially soon after the person taking them. Ang pagsusuot ng bra ay nakakatulong upang ma-reduce ang breast tenderness. Along with increased breast sensitivity, the hormones in the pill can make the breast grow bigger. A person should talk to their healthcare provider about severe breast pain or other breast changes, especially a new or changing breast lump. Okay, so for the fourth one, we have the headaches and migraine. The hormones in birth control pills can cause or increase the frequency of headaches and migraine. Changes in the female sex hormones can trigger migraine. Symptoms can depend on the dosage and type of the pill. For example, low-dose pills are less likely to cause these symptoms. Bahagyang pagsakit ng ulo ay karaniwan sa mga unang buwan lamang.
How effective is the contraceptive pills? The oral contraceptive pill is the most popular form of hormonal contraception in the United States and is highly effective when used perfectly. As many as 30% women report missing 1 or more pills per month, and approximately half of new oral contraceptive users will discontinue use within the first year. When taken correctly, the pill is over 99% effective at preventing pregnancy. So this means that fewer than 1 in 100 who use the combined pill is contraception will get pregnant in 1 year. Recent data from the National Survey of Family Growth indicate that typical users report a 9% failure rate, which may be due in part to pill-taking mistakes. Women who misuse or discontinue the pill are 3 times as likely to have an unintended pregnancy as those who continue the method. Some people take the pill by mouth to prevent pregnancy, and when taken correctly, it is up to 99.9% effective. The pill has the potential to be 99% effective at preventing pregnancy if you take it without fail, meaning you don't forget it to take the pill for even a day or 2. However, taking the pill perfectly can be difficult, which is why 9 out of 100 women who use the pill will have an unintended pregnancy every year. The pill is most reliable when you take it consistently at the same time each day, because being consistent helps keep hormone levels from fluctuating. Being able to control it and when you have children is a big part of maintaining your health, and so is choosing the right contraceptive method for you.
According to the Philippines FP 2020 Core Indicator Summary Sheet 2018-2019 Annual Progress Report, they estimated 7,176,000 of women are using modern method of contraception in the Philippines in the year 2019. As a result of modern contraceptive use, 2,630,000 of women unintended pregnancies prevented, 620,000 unsafe abortion averted, and 1,200 maternal deaths averted. 51% of these contraceptive method are using pills.
Pills is not for everyone. Who can take pills and who cannot. So birth control pills is taken safely by most women with no health issue to prevent pregnancy. And you cannot take birth control if you have any of this following. So first, if you have a blood clot or history of blood clot, history of stroke or heart attack, coronary artery disease, and if you have a suspected breast cancer, cancer of the uterus, cervix, or vagina, or unexplained vaginal bleeding, or even the jaundice, yellowing of the white of your eye or skin during pregnancy and during the previous use of the pills. And if you have a liver tumor, or suspected pregnancy. It will give a complication to your baby and to your health also. And if you have smoke and high blood pressure, uncontrolled high blood pressure or diabetes, you have a lupus, migraine, or you are active user over age of 35, the vessel will become hard and brittle that give a higher risk of plaque formation. So kung sa mga nabanggit na yan, kung meron kang nararamdaman na patuloy ka pa rin gumagamit ng pills, better stop mo na yan or talk doctor, physician, and nurse to help you what is the appropriate contraceptive that is right for you and to your health.
Family planning service usually include general health information, health history, and physical exam as well as the birth control method or contraception. Family planning service assists people in making decisions about when and if they want to have children by providing information, counseling, and birth control technique. What is birth control or contraceptive pills? The couple prevent pregnancy by avoiding unprotected vaginal sex. Birth control pills can help you avoid getting pregnant. But the pills can have other benefits too, including making your period less painful and more regular. Most packs of the birth control pills come in a week of placebo pills that don't contain any hormones. This method works the best if you take monopasis birth control pills which all contain the same dose of hormones. Hormonal birth control method that allow you to skip your period can help you to prevent your period related to anemia. Some of the benefits of birth control including reduced risk of ovarian, endometrial, and colorectal cancer, improved acne and hair growth, hirsutism, fever or no period and less heavy bleeding, monorrhagia. It is even increased risk of cervical and breast cancer for women who are currently take combined birth control pills, but this risk appeared to gradually decline to the normal level once you stop taking the pills, according to WebMed in taking a pills.
Family planning is not just about contraception, it is also about planning for child's present and future.
Ay, ganun po pala. Alam ko na po yung susunod na gagawin ko pagkatapos nitong pagbubuntis ko para hindi na madagdagan pa ng isa pa. Maraming salamat po sa kunting sa informasyon na ibinahagi niyo po sa akin.
Ano pa po, Nay, maraming salamat din po sa kooperasyon nyo para maibahagi ko po ito sa inyo.